Hello, everyone. Today we will study gastrointestinal system. In gastrointestinal system, the common disease is gastric ulcer. So we will study the drugs for peptic and ulcer gastric ulcer. Gastric ulcer are the common disease in gastric system in the world in each country because high incidence, high morbidity. About 10 to 12% of population, they are ulcer patients. So we have a lot of gastric ulcer patients. The region of gastric ulcer includes weather, such as cold weather induce gastric ulcer, and psychological factor, for example, anxiety. And food, yes, the cold, acidity, or pepper, and so on. This food also induce spicy, also induce ulcer. Heavily drinking and smoking induce ulcer. Next one is the hereditary factor. Let's explain this factor. What is your blood type? O, A, B, or AB type? Do you know? O type. The gastric ulcers morbidity higher than the other blood types 4 times. So it is the hereditary factor, gene factor, and infection. Do you know more than 90% gastric ulcer patients, they infect HP bacteria. So that means we treat gastric ulcer. And at the same time, we also need to use some antibiotics to inhibit or kill HP infection. So how to diagnose gastric ulcer? The patients feel stomach, and then we use gastric scope. You can find here is the wound, gastric ulcer. Here is the pepper ulcer. Okay, so diagnosis the gastric ulcer. Some factors can induce gastric ulcer. For example, gastric acid increase or pepsin increase, or more than 90% patients infect HP Helicobacter pylori. In fact, this bacteria induce ulcer. And in our body have some protective factors from gastric ulcer, such as gastric mucosa, such as bicarbonate. They are basic solution, such as prostaglandins, can protect gastric ulcer from gastric ulcer, protect gastric mucosa from gastric ulcer. And for ulcer patients, the aggressive factors increase and the protective factors are reduced. So that means later we treat gastric ulcer, we have 2 methods. The first method, we should reduce these aggressive factors. So we can use some drugs inhibit gastric acid secretion, inhibit pepsin receptor, or inhibit or kill HP bacterial infection. On the other hand, the second therapeutic method, we can increase these protective factors, such as we can use some gastric mucosa protector, such as we can use some basic drugs to neutralize acid, such as we can use some prostaglandins to treat a gastric ulcer. Because gastric ulcer, the aggressive factor increase and the protective factors decrease. So imbalance, and we use the method reduce and increase. So in clinic, used to treat gastric ulcer includes these 7 or 4 kinds of drugs. The first kind is to receptor blockers, such as cimetidine, ranitidine, and the second kind M receptor blockers, such as presenpine. The third one, gastrin receptor blockers, such as gastridine. The last one is a proton pump inhibitor, such as omeprazole, lansoprazole. These 4 kinds of inhibitors, they are same kind, acid secretion inhibitors. So the first one. The second kind, anti-acid drugs, such as aluminum hydroxide. This drug is the basic solution. The third one, gastric mucosa protector. For example, prostaglandin E. The last kind, inhibit or kill SP infection, such as some antibiotics, such as bismuth. So, we divide anti-ulcer agents divided into these 7 kinds, or 1, 2, 3, 4 kinds. Okay, the first kind, anti-acids. Anti-acids include these drugs, such as aluminum hydroxide, magnesium hydroxide, calcium carbonate, sodium bicarbonate. These drugs treat ulcer very easy because they are basic. Neutralize gastric acids overproduction and increase pH value. So used to treat stomach, used to treat peptic ulcer. The first one, in them, the most widely used drug is this one, aluminum hydroxide. And the pharmacological effects are very easy. Neutralization. The clinical using very easy. Stomach and gastric ulcer. The idle section includes constipation and systemic phosphate depletion. In gastric, in anti-acid drugs, this one, aluminum, is the most widely used drug. This drug, the trade name is Tercid, made in German in Bayer Drug Company, so very useful and a very big tablet. The patients, stomach or gastric ulcer patients, they chew the drugs to neutralize gastric acid. The second drug, magnesium hydroxide, used to treat gastric ulcer, have some other sections, such as loose stools and stimulating gastric release by inorganic magnesium. Number 3, calcium carbonate, so neutralize gastric acid, used to treat gastric ulcer, rarely used because some other sections, such as milk alkaline syndrome and renal calcinosis. The last one is the sodium bicarbonate. In your country, maybe rarely used, but in China, do you know sodium bicarbonate? In China, we made some powder foods such as 馒头, 饺子, dumpling, and we use this one, sodium bicarbonate. So that means in each Chinese kitchen, we have sodium bicarbonate. So someone stomach and they use sodium. Maybe they don't have anti-ulcer agents, but we have bicarbonate in our kitchen. So we use this drug as the drug. But this drug neutralizes gastric acid and then release carbonate, this iron. So maybe induce systemic alkalosis. The first kind, antacids. The most widely used drug is this one, aluminium hydroxide, the second case. Second case, they are inhibitors, inhibit acid secretion. The first inhibitor is histamine 2 receptor blockers, cimetidine, ranitidine, famotidine, and niraparib. The second inhibitor M receptor blockers, such as presenpine. The third inhibitor are proton pump inhibitors, such as omeprazole, lansoprazole, pantoprazole. The number four cat. The fourth inhibitor is the inhibit gastrin receptor, and the drug is proglumide. So let's study the first inhibitor, histamine 2 receptor blockers. Histamine 2 receptor blocker. In clinic, we use these drugs. The prototypical agent is cimetidine, Chinese name cimetidine, and the next one ranitidine, famotidine. These drugs, niraparib, these drugs are useful for treating gastric ulcer, are very useful for stomach. So just now I gave you the Chinese name means this drug are widely used in China in clinic to treat stomach, cimetidine and famotidine. Pharmacological effects of histamine 2 receptor blocker. This drug can block histamine 2 receptor, so inhibit gastric acid secretion, increase pH value. And the prototypical agent is cimetidine, and famotidine higher efficacy than cimetidine. So in clinic, we use them to treat gastric ulcer. To treat gastric ulcer, the hearing rate is 75 to 88%. Maybe you have the experience. Oh, I have used the histamine 2 receptor blockers to treat ulcer, but always recurrent. Why? You must know the wound, the ulcer need time to heal. So the patients use histamine 2 receptor blockers. The drug's duration you should remember 6 to 8 weeks. Use the drug 6 to 8 weeks, and then the hearing rate is 75 to 88%. Also used to treat duodenal ulcer. The hearing rate higher than gastric ulcer. The hearing rate is 77 to 92%. Don't forget the drug's duration. Should use the drug 6 to 8 weeks because the ulcer, the wound, need time to heal. Okay. The other section of histamine 2 receptor blockers, such as digestive system, induce dry or better taste amounts their urea, no problem. And urinary system induce reversibility, nephritis, and the blood system reduce granulocyte and reduce platelet. For this reason, the patients use the drug more than 2 months. They should test the blood test. And the central nervous system have some other sections such as headache, dizziness, cardiovascular system, induced bradycardia, arrhythmias rarely occurs. Endocrinal system means the long-term use. and maybe induce these adverse actions, such as male patients, myoplesia. But in fact, we should know histamine 2 receptor blockers, the adverse action mild and less. It is one kind of safety urgence. Okay, so next part. The second inhibitor, proton pump inhibitor, inhibits hydropotassium ATPase, and the prototypical urgent. We still widely used drug is this one, omeprazole. Trade name, made in Sweden, the omeprazole. The trade name is Losec. The pharmacological effects of omeprazole inhibit hydropotassium ATPase, so inhibit acid secretion. This drug used to treat ulcer, very useful, effectively and irreversibly. Not only can inhibit acid secretion, but also can inhibit SP infection. So for this reason, not only inhibit acid secretion, but also can inhibit the bacterial infection. So very useful and more powerful than the other drugs. Used to treat ulcer, gastric ulcer and duodenal ulcer. Very useful. Also used to treat upper gastrointestinal bleeding. Used to treat gastric ulcer, the hearing rate more than 97%. So very high hearing rates. But maybe you also said, oh, I found someone used the omeprazole, but the hearing rate very low. Don't forget, the ulcer, the wound need time to heal. So don't forget the drug's course of treatment. 4 to 8 weeks, the hearing rate is more than 97%. And use omeprazole. And you must tell the patients, empty stomach, oral administration the drugs will have the best therapeutic effects. The hearing rate more than 97%. The adverse action less than the other drugs. Only 1 to 2% of patients use the drug have headache, dizziness, or dry mouth, nausea, insomnia. Mild and less adverse actions. This year, omeprazole is the first one, and this year, new drugs such as lansoprazole, it is the second generation hydropotassium ATPase inhibitor. Yes, better than omeprazole. And we also have pantoprazole or ribiprazole. They are the third generation hydropotassium ATPase inhibitors. More higher efficacy, better than omeprazole, but you also know more expensive. More expensive than omeprazole. Okay. The third inhibitor, M receptor blockers, inhibit acid secretion. We studied atropine, but we should know we use atropine as the prototypical agent. In clinic, we use selectivity M3 receptor blockers, such as presenpine, to treat gastric ulcer. This drug can inhibit gastric acid secretion, also inhibit histamine and gastrin secretion. So used to treat gastric ulcer, but not as the first line agents. So we use cimetidine or we use omeprazole. Cimetidine cheaper than omeprazole, so widely used cimetidine or famotidine. And some patients will use omeprazole. This one, M receptor blocker, can use to treat stomach, can use to treat gastric ulcer, but not as the first line agents. not recommended for elderly patients. Do you know the reason? Because M receptor blocker also can block M receptor, also induce heart rate increase. So this drug have other adverse actions, such as induce tachycardia. So this drug is not recommended for elderly gastric ulcer patients. The fourth receptor blocker inhibit gastric acid secretion is the gastrin receptor blocker. The drug is proglumide. Competitive inhibit gastrin receptor, inhibit gastric acid secretion. Used to treat gastric ulcer, not as the first line. So just now we studied four kinds of inhibitors inhibit gastric acid secretion. Oh, the first one, M receptor blocker. The second one, histamine 2 receptor blocker, cimetidine, is widely used. And number 3, proglumide, gastrin receptor blocker, in the second line. And the last one, omeprazole. They are hydropotassium ATPase inhibitor, the best drug used to treat gastric ulcer. The highest healing rate. Don't forget, use the drug. And 4 to 8 weeks. In the first line, we also use histamine receptor blocker. And don't forget, the drug's course for 6 to 8 weeks. The third kind of drugs, the first kind, anti-acid. Just note, the second kind, they are gastric acid secretion inhibitors. The third kind, gastric mucosa protector. And includes this one, bismuth. Bismuth compounds this year are widely used. Bismuth can adhere to surface of gastric mucosa, protect the gastric mucosa, can increase gastroduodenal prostaglandins, growth factor, fibrogrowth factor synthesis, protect gastric mucosa, and at the same time also inhibit proliferation of SP. So, bismuth compounds, just now I said, this year, the new drugs are widely used because not only protect gastric mucosa, but also inhibit SP infection. Because more than 90% gastric ulcer patients, they infect SP. Though we use histamine 2 receptor blockers or other drugs, but this ulcer always recurrent because they infect bacterial. So means one hand we treat gastric ulcer. On the other hand, we should prevent or kill bacterial. So why just now we said omeprazole is the best drug? Because not only treat but also kill or inhibit bacterial infection. Same with omeprazole, this one, bismuth compound, not only treat ulcer, but also inhibit infection. So, very useful for ulcer patients. Okay, next one. Misoprostol inhibit gastric acid secretion and increase carbonate salt secretion and improve cell reconstruction and increase gastric blood supply. Can use to treat gastric ulcer. And also include this one. Okay. The last kind used to treat gastric ulcer inhibit or kill bacterial infection. For example, just now we mentioned the anti-ulcer agents. In them, some drugs, such as bismuth compounds, such as hydropotassium ATPase inhibitors, omeprazole, lansoprazole, can inhibit bacterial infection. And we also can use some antibiotics to kill bacterial infection. For example, amoxicillin, such as tetracycline, clarithromycin, and metronidazole. We use these antibiotics inhibit or kill bacteria. So, we studied anti-ulcer agents. Very easy. Clinical using, very easy. Used to treat gastric ulcer. And we studied this 4 to 7 kinds. The first kinds, 4 inhibitors. They are histamine 2 receptor blocker, cimetidine, M receptor blocker, presenpine, gastric receptor blocker, gastridine, and proton pump inhibitor, omeprazole. The second kind, antacid, the most widely used is this one, albuminum hydroxide. The third kind, gastric mucosa protector, such as bismuth. The last kind, inhibit or kill bacteria. We use antibiotics. So let's summarize how to treat a gastric ulcer. In clinic, we use 2 drugs. We should use at least 2 drugs. 1 drug treat ulcer from them, such as we use cimetidine or omeprazole or bismuth. And the second kind, we also should co-administer with some antibiotics, such as amoxicillin, such as clarithromycin. So do you know how to treat gastric ulcer? Omeprazole co-administered with amoxicillin is the best method. And don't forget the drugs course at least 4 to 8 weeks. Okay, class is over. See you next time.